Good afternoon, everybody. It's TJ here, clinic lead for CUC Medical. I'm going to be talking briefly about lower back pain today. It is one of the most common causes of attendances in the hospitals and with the doctors in the community, that is your GP. Remember, back pain is very common and usually improves within few weeks or months if treated properly. Um, it's called as lumbago. As I said, it's a very common occurrence and can be felt anywhere along your spine from neck down to your hips. In majority of the cases, that is 90% of the cases attending the emergency department, it is not caused by anything serious and will usually get better over time with proper lifestyle modification and treatment. But there are things that you can do yourself to relieve your back pain, and that one of the most important things that I always educate, especially my patients, is that stay active. You have to stay as active as possible and try to continue your daily activities as normal, because staying still only aggravates your back pain. It is one of the most important things that you can do. Resting for long periods is likely to make your pain worse. Similarly, exercising, try exercises and stretches for your back pain. Other activities like walking, swimming, yoga, and Pilates may also be helpful with your pain. If the lifestyle modification that includes staying active and exercising doesn't work, then medicine can help. And some of these medications are available over the counter, like the anti-inflammatory painkillers, ibuprofen, or you can always speak to your GP or a specialist in the community who can prescribe you certain medications. Um, Hot and cold packs can be used as well for short-term relief, available in any pharmacy. And the biggest thing with the back pain, especially a chronic back pain, is staying positive. It can be very difficult, but it helps if you stay optimistic and recognize that your pain should get better. Uh, if you will have a chronic pain can cause depression. It affects your lifestyle. It affects your work, getting out of the bed in the morning. So you might get a bit depressed and anxious with it. Um, but there are certain points when you have to go and see your doctor in the community, whether it's your GP or like in CUC Medical here. I myself am an emergency physician. We have orthopedics clinic here as well. So we can see you in the community. When do you have to attend this? When your pain is not getting better within a few weeks. If it's affecting your daily activities, number two. Number three, if it's worsening over time. And number four, if you're struggling to cope with it. Now, there are like your GP, a specialist, or a physiotherapist may recommend extra treatments if you don't think your pain is improving. Um, a lot of people talk about investigations and surgical options. These are two extreme ends of your treatment. When back pain doesn't respond to usual lifestyle modifications and treatment, then we consider further investigating it and referring you to a surgery. Investigations a lot of time only tell us that what we know clinically. So you go back to where you were. Investigations don't treat your symptoms, they confirm our clinical diagnosis. Okay. Um, Now, causes for back pain. It's often not possible to identify the cause of a back pain. Doctors call this a or we call this a non-specific back pain. Um, uh, uh, Sometimes it could be from an injury, like a sprain or a strain, but often it happens for no reason. It is very rarely caused by anything serious. Sometimes back pain can be caused by a medical condition, for example, a slipped disc, what we call in medical terminology as a prolapse disc, or sciatica, irritation of the nerve that runs from pelvis to the feet. So these conditions most of the time only require lifestyle modification and treatment. Very rarely they require surgery. Now, if you have symptoms of numbness, weakness, or tingling sensation, they need to be addressed immediately. They need to be taken seriously. Then you need to attend your physician or an emergency department. How can you prevent back pain? Doing regular back exercises. Your doctor or your physiotherapist can explain you how you can do that, as I said earlier, by staying active, avoiding sitting for long periods, taking care when lifting heavy stuff. There are courses that you can do for manual handling, making sure that the mattress on your bed supports you properly. Losing weight is one of the very important factors as well that helps to treat your back pain. You should seek medical help immediately if you have numbness, if you have loss of bladder or bowel control, if you have got high grade temperature, weight loss, or a swelling or a deformity in your back. And if your back pain has failed to respond to conventional treatment and therapy. Okay, if you have any questions and concerns, please ask us. You can ask these questions in our comments and we will respond to you. You can get more information on our website for CUC Medical. I hope you all have a good day and I will see you guys soon. Take care. Bye bye.